Autism, ADD, and comorbid conditions is something that's really important and important to me. I actually sued the Medical Board of California because they wanted to subpoena my patients' records over the patients exercising their right to privacy. And the reason they wanted to subpoena them is because I had the temerity to write in the recommendation letter that in addition to it treating his migraines, that the patient told me it helped his attention deficit disorder. And the medical board wanted to know why I recommended it for his attention deficit disorder, which of course I did not. And I won against the medical board, which is why I'm standing here before you today. And it is a published decision, and it protects the sanctity of the doctor-patient relationship and patient privacy. Now, in terms of autism, I avoided for a long time dealing with autism in children, not because I don't have the experience of dealing with children or the skill in dealing with certain childhood illnesses, but because the Medical Board of California is not very bright. My experience is when it came to cannabis, they didn't really know what they were doing. So autism is sort of a mystery, more than sort of a mystery. It's like many conditions in that you have a constellation of symptoms that can be caused by a number of different things. Voltaire, it was a little bit tough on physicians, but I think that unfortunately many of us deserve that, but I also think that physicians that are in the cannabis space tend to be much more patient-oriented and actually listen to their patients, which in this day and age is a rarity. So there's a lot of benefit that patients have gotten, and the reason I started treating kids with autism, even though I'm not a pediatrician, is I finally figured, look, it's worth my while to stand up to the medical board if they decide to come after me, because I would get these impassioned pleas from parents whose children had autism. And finally I thought, well, who am I to stand in the way between the patient and the benefit that they could get with cannabis? One patient was a 9-year-old girl, and I believe she was nonverbal or minimally verbal, and the parents came back a week later after we had started the child on actually a low dose of THC. And they said, we have never seen this kind of improvement with any conventional medication. There was a 30% improvement in our child, and not only did we notice it, but the teachers noticed it, and the teacher's aide noticed it. I was really honored that a fellow whose father was a contemporary of mine, a physician, and his son had severe nonverbal autism. And he said, you know, we gave him 25 milligrams of CBD the other night. There was a family outing, and he wasn't aggressive. He was happy. He was smiling. You know, can we get a recommendation from you? And this young man is now going to be in a residential care facility, and I've prescribed what for him will be effective, which is high CBD, low THC, and he's taking 30 milligrams of CBD, 1 milligram of THC twice a day. So the autism doesn't occur sort of in isolation. There's a number of comorbid conditions. As I mentioned, attention deficit disorder is one of the comorbid conditions. You often see PTSD with attention deficit disorder, obsessive compulsive disorder, and to my way of thinking, there's a certain commonality in terms of the cause for this condition, and that is a very rapid neurotransmission. And of course, we know that the endocannabinoid system is important in terms of slowing down the speed of neurotransmission. And we'll talk a little bit more about that later. Now, when we think of autism, we tend to think of the most extreme cases, the nonverbal cases, the child who's very aggressive, but it's just part of the autism spectrum, which can be as sort of minimal, as if you will, in comparison as social anxiety. And I had a mother and her 16-year-old son who came out to Santa Barbara from St. Paul, Minnesota, which is quite a ways. And at that time, Minnesota did not have a medicinal cannabis law. So I prescribed 2.5 milligrams of dronabinol to be taken 2 or 3 times a day because, you know, the symptoms are not sporadic. You have this problem all day long. And it must have worked because they came back a year later. Otherwise, maybe they like coming to Santa Barbara. That's not a bad reason to come to Santa Barbara. But then again, you don't have to spend a couple of $100 to spend some time with me. So the causes of autism are, generally speaking, genetic. And I know that there was a big hubbub and uproar because of something Pete Evans said in regards to immunization. And at one time I might have poo-pooed that, but I have had patients that have said, my child was normal until he was 18 months old, and then he had autism. And I am a public health professional, and I do believe in immunizations, but I think it's a lot like the story with Viagra, where 1 out of 10,000 men will have a heart attack. And that wasn't discovered until tens of thousands or millions of men were using Viagra. I think the same thing is could probably be true of immunizations, that it may be a very small number, 1 in 10,000. Obviously, immunizations are important from a public health point of view, but if you're one of the 1 in 10,000 or 20,000 or whatever the number is, that's 100% for you. And as a physician, I'm very ambivalent as to what to advise my patients. I mean, there is a solid public health reason to get immunizations, but there's also, I think, a realistic fear that my child could be the 1 in 10,000 or 1 in 20,000, and I think it's a very difficult decision for us to make as parents, because you would rather not have to use cannabis to treat autism in your child if your child didn't have autism. So people have talked about what's called an endocannabinoid deficiency syndrome. Dr. Russo is one of the people who popularized that, as well as Dr. Piamelli from UC Irvine. And now I'm going to talk a little bit about the speed of neurotransmission. And the reason that this is important is that if you have rapidly moving neural impulses, that you're going to tend to act first and think later. You're going to be impulsive. You're going to have poor anger management. And that is because the midbrain, the reptilian brain, the most primitive part of the human brain, sees things in terms of black and white, life and death, and it triggers the fight or flight response. And if you can slow down the speed of neurotransmission, and that's what increasing the amount of the cannabinoids do, whether it's endocannabinoids, synthetic cannabinoids, or phytocannabinoids, it's going to give the cerebral cortex, the frontal lobes, the more evolutionarily evolved part of the brain, greater opportunity to be rational and to say, take a deep breath. This isn't black and white. There are shades of gray. You're not going to die. It's going to be okay. So what's going on is that we need to know about the endocannabinoid system. We need to know about dopamine. The limbic system is another name for the reptilian brain. And we need to know about retrograde inhibition and about dopamine. And I'll try to go through that rapidly in a way that I make it understandable. you heard plenty about the endocannabinoid system, so I think I can skip that. But dopamine is important. The postsynaptic neuron sends the endocannabinoids back to the presynaptic neuron, and this causes a release of dopamine. And the more dopamine you have, the more powerful it is at depolarizing the presynaptic neuron, and therefore you have slower moving, fewer neural impulses that are moving along. And that's going to be important in decreasing anxiety, decreasing impulse control, and in assisting in anger management. So I think what you have is a dysfunctional dopamine system. Well, any number of genetic abnormalities could cause that. You could have too little dopamine, too much dopamine transporter. The way in which it's hypothesized that the cannabinoids work is that they compete with the dopamine for the dopamine binding receptors on dopamine transporter. And basically they throw out the dopamine into the general circulation, and therefore you have more dopamine available to have more retrograde inhibition and to slow down the speed of neurotransmission. Then, of course, there are the other attributes of cannabis that are contributed to by other cannabinoids other than THC. Certainly CBD can be sedating and anti-anxiety. Many of the terpenes cause stress relief and are also anti-anxiety. So we've had a number of evidence that the dopaminergic system is important in terms of the attention deficit disorder. It's certainly important in terms of autism. In reading up on this, I was baffled, I guess, or disturbed, because in talking about attention deficit disorder, some researchers said it was too much dopamine, some people said it was not enough dopamine, hence referring to it as some difficulty in the dopamine system is probably the safest way to describe it, because as Dr. Abrams has said, we need more research. But what we don't need more research for, by the way, is to recognize that if you have a parent that brings in a child to you who has social anxiety, has autism or severe autism, there's no reason not to have a trial, a clinical trial of one, if you will, to see whether or not this child responds favorably to cannabis. And my experience with a small patient population who have autism has generally been quite favorable. So again, the dopamine by the retrograde inhibition slows the speed of neural transmission, and it helps the person think first before they act. It does not cause the limbic system to go haywire and say, attention, attention, red flag, get out of here, or start a fight with somebody because you need to act first and think later because you're in danger. So I think that autism, PTSD, attention deficit disorder are an overload of the midbrain due to rapidly moving neural stimulation. The amygdala is the center for rage. I think you're overstimulating the amygdala. And the limbic system is important in controlling our emotions. And if the limbic system is sort of out of whack, our emotions are not going to be reasonable. They're not going to be consistent with the situation that's facing us. And by slowing down the speed of neurotransmission, we're giving our cerebral cortex a greater opportunity to operate. So the synapse there, the synaptic cleft, is between the presynaptic neuron and the postsynaptic neuron. And the postsynaptic neuron sends cannabinoids back to the presynaptic neuron. And every neuron is, depending upon which way the neural stimulation is going, could be either a presynaptic or postsynaptic neuron. So the postsynaptic neuron sends the cannabinoids back to the presynaptic neuron and causes a release of dopamine. And the release of dopamine causes depolarization by exchanging the electrolytes outside the neuron with those inside the neuron. And until that neuron repolarizes, it's harder for the next neural impulse coming along to stimulate that. And you can see if that information, that message that is going into the brain is that this is something that could be anxiety provoking, this is something that could be traumatic, that if you slow things down a little bit and give the cerebral cortex a greater opportunity to be rational, you're less likely to act first and think later. Most of us would like to think first and act later. And I know with my patients with post-traumatic stress disorder that I've used the example. I said, I'll bet that you have been having a drink with a buddy, that you've had this experience and having a grand old time, and then the guy pushes your button. Either he says that Trump is a great guy or he says that Trump stinks, and all of a sudden you get into an argument. And 2 hours later, you step back and say, what happened? We were having a good time. Why did I do that? And the reason I tell them that they did that is that they felt threatened. They interpreted that as a threat. They saw things in terms of black and white. And when they had a chance to relax and reflect on it, they recognized that this was not really the way they meant to act. And if you had more cannabinoids on board, it would slow down the speed of neurotransmission, and that reflection would take place within a second or two, rather than having to wait 2 hours until you calm down. Okay, so I mentioned the dopamine transporter. Now, I originally made this for PTSD, and I think what happens in PTSD is that the body produces more dopamine transporter. It probably does that on demand when a person is faced with a traumatic event. And the fact of the matter is that children with autism may in fact produce more dopamine transporter, tying up the dopamine when they see a traumatic event. And if you can free up that dopamine by having increased cannabinoids, you're likely to have less influence of the reptilian brain and more influence of the cerebral cortex. So retrograde inhibition is an important concept to take away in regarding the endocannabinoid system. It obviously explains why cannabis is useful in treating epilepsy, why it's important in treating migraine headaches, why it's important in treating the autism and its comorbid conditions. So this is one of the lesser confusing diagrams that I could find demonstrating the postsynaptic neuron sending cannabinoid signaling back to the presynaptic neuron, which is going to cause release of dopamine, and the dopamine is going to cause depolarization of the presynaptic neuron, thereby slowing down the speed of neurotransmission. So by having this decreased speed of neurotransmission, you slow down the amount of sensory input, which helps explain why people with attention deficit disorder or attention deficit disorder hyperactivity disorder say that they're able to focus and concentrate better, because it increases dopamine. Now, the fact of the matter is that these stimulant drugs, these sympathomimetic drugs, are able to increase the amount of dopamine because the sympathomimetic molecule attaches itself to the dopamine molecule, making it more difficult for the dopamine molecule to be metabolized, and so it can also cause the slowing of neurotransmission. And this just tells you where some of the CB1 receptors are located. Many of them are located in the reptilian brain, and as I indicated, the reptilian brain is important in terms of fight or flight, seeing things in terms of black and white, and life or death. And we've already mentioned both the limbic system and the amygdala. Here's a picture of where they are, not that that's important. Another picture where they are. So the reptilian brain, as I said, is the most primitive part of the human brain. It sees the world black and white, life and death, triggers fight or flight. And we need to slow down the speed of neurotransmission to allow the more rational cerebral cortex to affect our thinking before we act. I think that in terms of autism, that we take a look at what I've been talking about, that it affects the midbrain, causes a release of dopamine, triggers retrograde inhibition, probably slows the speed of neurotransmission, and allows the cerebral cortex to more rationally assess fear, and it slows down the thoughts that are transmitted to the limbic system, giving the cortex time to process more rational thought, and decreases emotional excitability. I think that it can be used in conjunction with conventional medication, with counseling, with cognitive behavioral therapy, and since there are other comorbid conditions like anxiety, depression, and ADD, and they can be treated as well. One of the things that most of us that are clinicians in the cannabinoid medicine space have noticed is that cannabis works very well in conjunction with other medications. And many of these children come in with a list of medications as long as your arm. And some of them are able to either decrease their dosages or to decrease the use of those medications altogether. And that certainly is a benefit all the way around, except maybe to the pharmaceutical companies. So many of the pharmaceuticals have side effects. And the decreased libido, somnolence, increased weight, feeling of being depolarized or like a zombie or being drugged, and the therapeutic effect of cannabis and the intention of the pharmaceutical drugs is to make the patient more manageable, to increase their concentration, decrease their anxiety, increase their comfort level around others, manage anger better, and have more patience with life, inanity, and insanity. And I think those of you who have dealt with children that have autism and that have responded to cannabis appreciate that they may have benefited for some or all of these therapeutic effects. And I think the other thing we need to recognize is that the DEA's chief administrative law judge in 1988, after a 2-year rescheduling hearing where he recommended rescheduling cannabis to Schedule II, in his finding of fact said that cannabis was one of the safest therapeutic agents known to man. Now, it is true that CBD, and particularly high CBD, can occupy the CPY450 enzyme system and may have an effect on other drugs. The one that comes most readily to mind is Coumadin, which is a blood thinner, and all you need to do is lower the dose of Coumadin. It's not something that is a medical emergency or anything like that, but you need to be aware of that particular side effect. And as I think Dr. Abrams mentioned, it may interfere with the metabolism of some of these other drugs, and it might in fact cause them to be more effective. Although in many cases you don't need some of these other drugs, and you can lower the dosages as a result of the beneficial effects that you're getting from cannabis. Okay, so this is just a repeat of what I said because there. It seems to me that autism is a disease of neurotransmission. It's a disease of the reptilian brain having more influence on our thoughts and actions than is healthy. And what the cannabinoids do is they help decrease the influence of the limbic system, and it's important. I mean, it's important for our survival, but not when it's acting when there isn't real danger, when we don't have to act first and think later. And in autism, we too frequently are acting first and thinking later. We're too aggressive, we're too angry, and that the endocannabinoid system, as well as help from synthetic cannabinoids and from the phytocannabinoids, can be damped down and can be put sort of more in its natural place. And again, I'm just repeating this, but I do want to point out that cannabis is almost too good for its own good. It has such a broad range of therapeutic benefits. It is an antidepressant. It is an anti-anxiety. It is a stress reliever, and it does slow the speed of neurotransmission. All of those therapeutic benefits are useful for somebody who has autism. This slide shows some of the effects of various cannabinoids, and it's really a plea for the entourage effect, the idea that whole plant cannabis is much more effective than any single isolate. But as I indicated earlier in my presentation, I did have this child from Minnesota when they didn't have legal cannabis there, and he did benefit from THC alone. And what I tell my patients is that I prescribe dronabinol or Marinol for is it doesn't work as well as cannabis, it's more expensive than cannabis, and it has more side effects than cannabis. But for many people, it does work. Many people feel more comfortable going into a pharmacy or buying a prescription drug that has been on the market for 30 years than going into a dispensary. And if they're really lucky, they have an insurance company that will pay for the off-label indication for Marinol. Okay, so we've already talked about the fact that it's an anxiolytic. It'd be nice if I spelled it correctly. A number of the cannabinoids can contribute to that. Sleep is important. I think both THC and CBD as well as CBN are helpful. CBD is an antidepressant. Many of the cannabinoids have muscle relaxant benefits, and that too can be helpful in terms of dealing with a child with autism or excessive anxiety, that by having the stress resulting in increased muscle spasm, it sort of feeds on itself. And most of us, when we have too much stress, feel it in our neck, and it just makes us feel more stressed. In fact, some of my patients who have degenerative arthritis or have stress apply topical tincture of cannabis to the trapezius muscle, and the muscle relaxant benefit can be helpful even with topical application, and not necessarily need to use oral administration. Terpenes are important. This is really Dr. Russo's ballpark, but there are a number of terpenes that contribute to stress relief, and of course, children that have autism or other conditions on the autism spectrum will benefit from these. And limonene is in citrus fruit, linalool is in lavender, beta-caryophyllene is in pepper, alpha-pinene is in pine needles. So there's a lot of these that are available at your local supplement store. You don't have to jump through a bunch of hoops as you do to get cannabis, and there may be some relief with this. Also, you have terpenes that have sedative effects. This is a list of some of them. As was pointed out earlier, Myrcene is very helpful. Myrcene often accentuates the benefits of THC, but it also has therapeutic effects in its own right. What Ed Rosenfeld, who writes books on growing, said in one of his books is that if you're growing cannabis or using cannabis for recreational purposes and you got some that is not getting you the altered state of consciousness that you're looking for, if you eat a mango an hour before you consume that, it will get you higher, and that's because mangoes are a pretty good source of myrcene. So because autism is caused by not one thing but many things, in my experience, the dosage and THC CBD ratio is quite variable, anywhere from 2.5 milligrams of THC for social anxiety to 25 to 30 milligrams of CBD 2 times a day, and frankly, any ratio in between. It's a trial and error situation, but I think if you stay in this dose range, particularly to start with, this is a good place to start. As far as what the right place is to end up, that's quite individual and quite personal. Some people worry about safety. What am I, giving my child here? He's got autism. Is something awful going to happen? Pretty much every major study that's ever been done by any country, whether it's the UK, Australia, Canada, the United States military in the Panama Canal Zone, have all recommended legalizing cannabis for recreational use. And we're talking about using it for medicinal use. I mentioned the DEA's chief administrative law judge, in 2005, of course, nabiximols was approved in Canada. It was approved in the EU in 2010, and even the FDA said that nabiximol was safe enough to test on human beings. And, I'm kind of a historian. I mentioned before that in the 1920s, American doctors wrote lots and lots of prescriptions that had contained cannabis, and that in 1937, Dr. Woodward said that the AMA knew of no dangers from the medical use of cannabis. And this is just a repeat of the DEA's chief administrative law judge, and repeat of what Dr. Woodward said. So I think that cannabis can certainly be efficacious in the treatment of autism spectrum disorder, and I think the future is bright for research on the relationship of the endocannabinoid system with the autism spectrum disorder. Now, we may see synthetic cannabinoids and selective anandamide reuptake inhibitors that enter the scene as well. Right now, I think cannabis is something that's perfectly useful. We now get to the shameless commerce division of this presentation. This is a book that I wrote for those of you that are interested in the policy, interested in history, and interested in the spirituality use of cannabis. And this is another book that I'm hawking here. Thank you very much. I really enjoyed speaking with you today.